So, for anyone who's wondering why natural medicine isn't in our US healthcare model, which you should be asking yourself that question because these aren't two different fields in other countries. Okay. You go to Taiwan, you don't have natural and alternative healthcare and then traditional medical care because they never had big pharma investors come in and completely infiltrate their healthcare model. But for anyone who's ever looked at our healthcare and been like, man, what happened? And I would make natural medicine. It's all complementary and alternative medicine. And then like medical care be so in its own silo. I'm going to tell you what happened. So before 1910, medical schools could pick and choose their own curriculum. And they would pick, anything was on the table. So they would pick any combination of natural modalities as well as medical surgeries, pharmaceutical drugs, or pharmacology, and other more cutting edge technologies. And so the medical schools, we had about 230 here in the United States, and they all had varying degrees. Some of them focused exclusively on a few modalities. Others had a variety of different modalities. What we see happen is the two largest investors in the pharmaceutical drug industry wanted to reform medical education in the United States. They said, hey, we can make medical education better. So let's come out with a list of rules that medical schools need to follow in order to elevate the standard of education that doctors are receiving. Now, I will say this, there were some very good items included in that mandate related to, for example, requiring that doctors receive at least 2 years of anatomy and physiology. Like, that's a good thing. There's something to be said about implementing some level of regulation so that people who are going to medical doctors, you get a more reliable interaction with people if you know that they've been trained on certain topics. So there were some good outcomes that came out of their initiative of elevating the level of education that medical doctors receive in this country. That said, there were a lot of things that didn't need to be included in that report that were included. For example, they had racist clauses that said that Black Americans who were attending schools for Black doctors could only treat other Black Americans. They couldn't treat people of any other races. And the amount of open practicing medical schools for Black Americans reduced to 4. Okay, so that took a huge impact on the amount of Black physicians we have in the United States. But the other crazy inclusion was a clause to remove natural therapies so that they could focus on the development of modern medicine. It literally said, because natural medicine is in direct competition to the advancement of modern medicine, you remove naturopathy, osteopathy, various botanical medicine, hydrotherapy, electrotherapy, homeopathy. It just listed them out, these things that you need to remove from curriculum. And so all these medical schools were confronted with a choice. Do we completely narrow down our curriculum to the standard US medical approved education, or do we close our school because they wouldn't receive accreditation or funding from the general education fund that Rockefeller set up? So Carnegie funds the Flexner Report and gives a very generous donation to the American Medical Association to mandate that report. Rockefeller sets up this fund. They agreed to fund and then accredit the schools who comply. We go from 230 medical schools down to 60. And the only ones who could stay open were exclusively allowed to focus on pharmacology, surgeries, and other forms of advancing modern medicine. So that's really how we got here. Everything natural pretty much got picked out and removed, and it hasn't been put back in. Or else people would be handing protocols to their patients of what are all these natural modalities of healing that are proven to reverse this disease or to have a favorable outcome on your symptoms. Clients aren't provided that education, and actually doctors aren't even taught it because it never got put back into our medical curriculum. And for those who are saying like, oh, but there's complementary and alternative medicine departments at medical schools now, as long as you call this information complementary and alternative, I don't want to hear from you because this information is not complementary and it's not alternative. This is true primary care that the American people have been deprived of for the past 113 years. And until these things take their rightful place as actual primary care, I don't want to hear about your CAM department. Although I am very happy that there's quite a bit of clinical research now being done on those modalities of healing, which in the past would only happen when it would work to alleviate the side effects of a pharmaceutical drug. Okay? So that's how we got to where we are. And just so you know why my school exists, Holistic Health Educators, we opened up an online school of natural medicine so that we could bring the science of natural healing to the people delivering natural health education and natural health solutions to their communities. And so that we could take medical professionals and expose them to this whole world of healing that they were never taught. That if they heard of it, it was to call it pseudoscience and call it misinformation. We get to take these medical professionals, expose them to this whole world of healing, modalities of healing from around the world, the science of holistic nutrition and nutrient metabolism, and all these biological processes, breath work, XYZ, you name it. We get to bring these two fields together because that's how it should be. Educational institutions should be able to provide a variety of training to the professionals coming through their program on the modalities of healing that really work without someone saying what you are allowed and disallowed to include. My heart really goes out to practicing medical professionals right now because as more and more of them have come into our school and learned this information and received our protocols, our 5-step protocol for candida, our 7-step protocol for diabetes, our 6-step protocol for constipation, our 5-step protocol for acid reflux, we have all of these protocols written out. If they were to give their clients our protocols instead of a pharmaceutical drug, it would decrease their level of compliance to practicing good standard of care medicine, and it would decrease their ranking with insurance companies, so they would get less referrals and less of a payout. And this isn't to say that the doctors are just money driven. I'm talking about this person's practice being able to survive or not, then keeping their license, them getting enough patients to keep their doors open. They're literally forced to practice pharmacology as the first line of defense because the less they practice pharmacology as primary care, the further down their rankings go. They are so painted into a corner in this situation. This is where policy level decisions, it's either going to have to happen at policy level or we just literally create our own healthcare system where these people can practice medicine according to their own intuition. I can't imagine being a doctor and wanting to give people one set of advice and having to be compliant to what you graduated with or what the regulations of the time are. So we have a lot of work to do here over the next 10 years in this country. We have a lot of support to provide each other as we come up against extremely powerful institutions. And I'm going to leave you with this. Back in the day, before things like social media, before things like literally millions of people getting educated about what's really going on in our country all at the same time, I do think Carnegie and Rockefeller were so powerful that they could successfully flip our medical model on its head and create a hierarchical power structure and keep the people uninformed. I don't believe that's the case anymore. The people absolutely hold the power. The consumers hold the power. The American people hold the power. People around the country hold the power. It's about enough of us believing we have the power in order to unify and show up for each other and have each other's backs so that if the system keeps on trying to crack down on people who are open to changing the system, that they don't all just get taken out. It is our responsibility to bind together and to reform the system from the ground up, person to person, practitioner to practitioner. We are more powerful than the people at the top. We can't just be sitting at home complaining about what's going on. We need to get educated, we need to get connected, and we need to believe that this is going to happen over the next 10 years. So that's my invitation to you is to join us on this mission that we're on, because it's going to be incredible what happens over the next decade, but we got to stick together.